This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Jeremy Wolf.
Hello, friends, family, great community, extraterrestrials, anyone out there listening, welcome to the show and welcome to our guest today. We have a special guest. She actually, if I'm not mistaken, she lives here in the community, Dr. Gomez in Cooper City. So she is, by virtue of that, a good neighbor of the show, and we're happy to have her on. And Dr. Gomez, it's Dr. Nancy Gomez. She joins us from TULA Mobile Chiropractic. Should I call you Dr. Gomez, Nancy? What's the best way to address you?
Whichever way you feel comfortable. My patients call me both.
Okay, I'm going to go with Nancy then to keep it,
Let's do it.
less formal here. So Nancy, welcome to the show. Pleasure to have you here.
Thank you so much. I'm happy to be here.
Of course. So I know you mentioned this when we first spoke, the name of your business, TULA. It stands for balance, correct?
Correct.
So I love that. We're going to get into that later, but I wanted to kick this off with a little quote that I found interesting here. And it's this: the body heals with rest, the mind heals with peace, and the spine heals with alignment.
Nice.
As a chiropractor, how does this quote resonate with your approach to helping patients achieve balance and optimal health?
I think that the quote encompasses it all. It's mind, it's body, it's spirit. So we're a combination of everything. So we want to be in balance with as much as we can.
Balance is super important. So let's start off there. Tell us a little bit about your business. I've interviewed plenty of chiropractors on the show. I've not yet had a mobile chiropractor, nor had I really heard about that. But if you think about it, it does make a lot of sense because generally speaking, if you need to go see a chiropractor, you're probably having issues with mobility. So if you could have the doctor come to you, that makes a lot of sense. So tell us a little bit about TULA Mobile Chiropractic.
Yeah, so TULA Mobile Chiropractic, as you said, we're a mobile business. And so we go to people's homes and I integrate chiropractic adjustments, therapeutic massage, trigger point dry needling, a lot of different bodywork techniques, all in the comfort of your home or office. What's really cool is that I get to know people's families, their environments, their pets, their coworkers. So being in people's environments and having more hands-on time with them really helps me improve their lives better.
Yeah, absolutely. It does make a lot of sense. You mentioned trigger point needling. Is that similar to acupuncture or is that what?
Yeah, so trigger point dry needling. So yeah, it's akin to acupuncture, but we don't really follow the energetic channels like acupuncture does. We pretty much find trigger points or knots within the musculoskeletal system, and we focus in on those.
Now, what areas do you service? Obviously, we talked that you live here in Cooper City. What's the extent of where you will travel to go see someone?
So Broward, Boca Raton, Delray Beach. I have a lot of clients in Boca and Delray. So I go up that north 2-3 times a week sometimes.
Nice. So how did you decide, or when did you decide? Talk a little bit about the evolution of the mobile chiropractic business. How did you land on doing that? What does the background look like?
It's a bit of history involved with it.
All right, let's get into it.
I started my career as a massage therapist. I've been doing body work for 25 years. So I started off as a massage therapist, and throughout my career as a massage therapist, it evolved. I became a lot more interested in body work and the capacity of it, and I decided to go to chiropractic school. In chiropractic school, I think I had a really great advantage because I had already had about 8 years of experience working on bodies. So I had the touch. I knew how to relate to people. So my patient care and my bedside manner was already developed, and I knew how to move the body. From there, I was very interested in integrating the two, massage, which was so innate to me, and with chiropractic. So that has always been my passion with doing body work, is combining the two. The mobile aspect with massage, you do house calls. It's just part of your practice. So throughout massage school, I was practicing some adjustments on my clients as appropriate. And it just stemmed from there. Going to people's homes and doing massage and chiropractic together, it just makes sense.
Yeah, it does definitely make sense, like I said earlier. And what are some of the typical or common, what are the most common myths or misconceptions that you typically hear from patients? I know a lot of people out there, they hear, maybe not so much anymore, but you hear chiropractor and you think of a doctor just doing quick adjustments to fix things. What are some of the things that you typically hear from patients in this space?
Yeah, I do hear a lot about that when I treat my clients, because I do work on them for much longer. My sessions are typically 45 minutes to an hour long. Of course, they do enjoy all of that hands-on time and all of that personalization. But as a profession as a whole, I think that chiropractic has really moved away from a lot of the misconceptions of we're working in multidisciplinary clinics now. I think the medical community has really embraced us as a standard of care for musculoskeletal conditions before going into more invasive surgeries or interventions. I think a lot of that is due to a lot of the research that's been done with spinal manipulation and a lot of the evidence-based practices and guidelines that we've received in treating clients, just learning best practices on how to treat lower back pain, understanding better the prognosis of some of these injuries, how long it's going to take for them to heal, what kind of therapeutic interventions work best, home exercise protocols. I think that our profession's done a lot of work with debunking a lot of these myths as kind of being seen more as a philosophical practice in the past, and now we've emerged to more standard of care.
Yeah, and certainly with the abundance of information that's available nowadays, all that research you were talking about is so readily available. And I think we're seeing, if I'm not mistaken, a shift to more holistic practices of healing, as opposed to trying to just treat the symptom and not really get in there and fix the underlying problem. And I think I mentioned to you when we spoke initially, I've been doing a lot of recordings with people in the holistic healing space. You mentioned a previous guest of the show, Dr. Bhuvendran at the Pro Institute. They take a holistic approach to sports medicine and regenerative medicine and that kind of thing. I think that's like on the forefront of many's minds nowadays, because we do live in a society that's geared towards instant gratification and quick fixes. And there is an epidemic of health in this country. So I love raising awareness around these topics.
Yes, thank you.
Yeah, absolutely. So you had mentioned also, we were talking before the show, we both have daughters around the same age. You have an 11-year-old that goes to Pioneer. My daughter Emma goes to Pioneer as well. She's 1 year ahead. Obviously, for most, family is often the backbone of what we do. It's probably one of the most important, if not the most important things. Tell us a little bit about your family. Is that your only child? Do you have any other kids?
Yes, Mila is my only daughter. My husband is
an architectural photographer. Nice.
Yeah. So I have my previous life. I was a theater major. I went to New World School of the Arts in downtown Miami, which is affiliated with the University of Florida. So him and I joined mostly because of our love of art and photography and theater. And so Mila is following the same path. She's a competitive dancer. So we're all very immersed in her dance life. So that's where we spend a lot of our time and money, honestly.
Competitive dancer. So what kind of dance does she, is it like hip hop type dance? What kind of dance are we talking about here?
Her studio works with every kind of dance. Ballet is the backbone, of course, but they do hip hop and jazz and ballroom, all kinds of dance.
What studio are we talking about here? Where does she go?
She goes to Dancers Gallery, and so she's part of the cast competitive team.
Shout out to Dancers Gallery, another local business here in the community. Woohoo! Very cool.
Yeah, we're a really great family. I enjoy my experience there, and so does she.
Nice. So looking back through your journey, I find the older I get, the more aware I am of the struggle, and I find that I often gain more insight from the more challenging and difficult experiences than the rewarding experiences in my life. Whereas in the past, when I was younger, I was like, why do I have to deal with all the stress and hassle? I just want everything to come to me easily. But the older I get, I really do feel grateful for the struggle. And often we're defined by some of our most challenging moments in life. Looking back throughout your journey, is there something that comes to mind, a specific time in your life, a hardship, something you struggled with, or some challenge that you faced that at the time going through it, you were shaking your head wondering why this was happening to, and you couldn't find any reason for this. And it seemed like the end of the world. But now fast forward to where you're at today, you could say you're grateful for having gone through that experience.
Yes, Jeremy. I think that probably in my mid-20s was one of them when I was deciding what I wanted to be when I grew up. I had this immersive, passionate experience with theater, but then I had to make money. So I went to massage school and I was doing massage at the same time. So I had to make a decision in my mid-20s. What was I going to do? Am I going to continue to pursue theater and go get my master's in theater? Or am I going to pursue body work? We know what won, but it was a struggle to make that decision. You could go to college for something and then end up not doing what you majored in. And that's okay. I think another one was more recently, I had worked for a company developing a company, and I was the vice president of operations for this company for 10 years. We were a holistic company, chiropractic company that went into substance abuse treatment centers, and we opened up our own clinics within these treatment centers and provided chiropractic and acupuncture, massage, yoga, nutrition, like a whole holistic package for the community that was undergoing substance abuse treatments. So rewarding, amazing. It was a very left brain role for me because I did operations. I worked with HR. I worked with documentation, insurance company, compliance. And for a little while, I backed off on doing hands-on care just so I could focus in on that. But last summer, unfortunately, because of poor insurance reimbursements and guidelines, we had to close the company. So I think that was another crossroads for me, and how I decided to really take the next step and really put all of my focus into TULA Mobile Chiropractic and get back into full-time hands-on care, rekindle my fire for what I really love to do. What I'm really passionate in doing is patient care. It was a struggle. It was another breakup that was hard. It's really lit a fire in me, and I'm really grateful for that.
Love it. Love it. Yeah, there's something about helping other people, and not just helping somebody like a surface level help them carry a bag, that kind of thing, but actually helping somebody transform their life, transform their well-being, transform that, and seeing that process. I was just talking to my daughter about this the other day, over the weekend. And you know, as most 12-year-olds are, they're pretty self-centered. Kids are focused on what they want. And I started having a conversation about how the older I get, the more I realize that you get so much, I'm trying to remember how I phrased this to her, but you get so much more out of helping other people than you do focusing on yourself and really doing what you do. And I'm trying to shift my focus away from that. I've always, going back in my 20s and 30s, I'd always also been very materialistic, right? I thought I was a good person because I hold the door open for somebody. But when you really dug into it, was I really helping people on a deeper level? And it's something I've been exploring very deeply on the north side of 40, which is probably why I've been speaking with so many people that are in holistic healing and practices and being and spirituality and this whole space. It's just fascinating to me. And it's really given me a sense of purpose and meaning in my life. So I'm always happy to have another person that has that on their radar in the professional space. It's nice to see. It's refreshing.
I think at the root of it, it's kindness.
Mm-hmm.
Kindness to one another is just the baseline of being a good person.
Kindness and gratitude, right?
Mm-hmm.
I just had a guest on the show, Leighton Campbell. He wrote a book called The Happiness Equation. Check out the episode we did on the podcast. And he basically came up with an equation for happiness, like a mathematical equation. And I'm not going to get into the structure and how he came up with it, but he was talking about how gratitude turned out to be an exponent in that equation. And this idea of being grateful all the time for everything. And that's another thing that's been sharp on my mind as well. So
yeah,
good stuff.
Very good.
What would be one thing, and this can be related to your business, this could be any personal wisdom, something you'd like to leave our listeners with, again, a little nugget, a little piece of wisdom, anything you want to share?
I wish I could give a life wisdom nugget. I'll take the opportunity to just explain my practice a little bit more, if you don't mind.
Absolutely.
And I think it also goes back to the myth of chiropractic, at least as it relates to how I approach my profession, is that it's not just about popping and cracking joints and getting things back into the alignment with an adjustment. But I use a lot of different tools in my toolkit to address people's conditions. Anything from like acute pain or chronic pain or wellness or even kids. I just want people to be able to function, to have good mobility so that they could do the things that they love. So I can approach somebody's situation with a chiropractic adjustment. If that's not appropriate for them, I could use a little tool called the activator that really helps with joint mobility. Or I could get in there with my hands and do very specific manual therapy or massage, assisted stretching, trigger point, dry needling, anything that somebody would need from whatever angle. I really try to provide more personalized care and make it, more accessible for people who aren't really into getting adjusted, or if it's not appropriate for them to get adjusted. It's important for me to help people and provide body work for them.
Yeah. And really give them, I'd imagine, try to give them the tools that they need to make changes moving forward in their life. Because as we both know, there's no quick fix with any of this. Sure, you can go in and get a quick adjustment and it might give you some temporary relief, but the underlying condition is probably not going to go away. And like with anything else, it takes lifestyle changes, it takes work, it takes all sorts of stuff, right? Proper nutrition, exercise, proper mental space, all this stuff. You got to do all of it. And there are no shortcuts, but it's all worth it in the end.
Exactly. Motion is lotion for the body. So getting out there, being active, I guess that's my little nuggets of wisdom, is people that hold their adjustments the best are the most active people, especially squats.
You just reminded me I need to get back out there and do my squats.
That's right. Me too.
Very cool. All right. Anything else? I'll give you one other thing. Anything else you want to share before we wrap up here? Anything I missed?
No, I think that you asked some very good questions and we were able to get into it a little. So it was a lot of fun.
Perfect. Nancy, it was a pleasure having you on. Thanks so much for coming on the show and telling us a little bit about what you do.
Thanks, Jeremy. It was a lot of fun. I appreciate it.
My pleasure. And thanks, as always, to our listeners for tuning in. If you like the show and you have any comments, please leave them below. We'd love to. If you have any suggestions, anyone you want to see on the show, let me know. We'll reach out. We'll see if we can get them on. Until next time, everyone take care and have a blessed day.
Thank you.
Bye.
Thanks for listening to the Good Neighbor Podcast, Cooper City. To nominate your favorite local business to be featured on the show, go to gnpcoopercity.com. That's gnpcoopercity.com or call 954-231-3170.